are. And if your Sabbath is not yet closed, happy Sabbath again. But thank you for taking the time to come out and hear this presentation on drug use. I am going to share my screen. I'm not sure if I have that. I think I have that as yet. Okay. All right, is everyone seeing the screen?
Yes, we do.
Yes.
Yes. Perfect, thank you. All right, so today, as I said, we're going to speak about drug use. And I know Fred mentioned that if you have a question, you can write it down, but if you do have one and you want me to stop because you want to talk about a particular slide, that's fine. I think you can I think I can see the raised hands, but you can let me know and I'll stop and try to answer it as well. Actually, my slides are going by too fast. Give me 1 second. All right. Okay. So what is a drug? So a drug is a medicine or any other substance which has a physiological effect when ingested or when it's introduced to the body in other ways. Drugs are something that affects not only the body, but it affects the brain as well. And again, a drug is a substance that is used to prevent, diagnose, to treat, or to relieve symptoms of a disease or an abnormal condition. So drugs can also affect how the brain and the rest of the body works, and it causes changes in mood, in awareness, in thoughts, in feelings, in behaviors. And some types of drugs, such as opioids, may be abused and lead to addictions. But not all drugs lead to dependence, and not all drugs users, or not everyone that uses drugs or alcohol want help to quit the drugs. Or some of them don't need help. Some of them are able to quit on their own. But that is not the vast majority of folks. So the brain is like an incredibly complex and intricate computer system, as we see in this slide here. Instead of electrical circuits, though, and being used on a silicone chip, it is controlled by electronic devices. The brain consists of billions of cells called neurons, which are organized into circuits and networks. Each of these neurons act as a switch controlling the flow of information. So if neurons receive enough signal, they're able to send signals of their own, causing other neurons to react as well, which is kind of what you see in this picture here. And then this picture here just kind of shows you just all the different things that your brain is doing or is capable of doing, and it does that simultaneously. And one side is the creative side, the other side is more so the analytic side. And just one side note,
we don't see the picture.
You don't see the slides?
No, we haven't seen them yet.
Okay. Let me try sharing it again. Let's see if that works. Are you seeing them now?
Yes.
Yes.
So this was the initial slide that I mentioned that just talked about drugs. And then this was the slide that we were on. And again, this slide or this picture in the upper right was what I was talking about just now, that speaks about the two different hemispheres of the brain. And as I was saying, with just a side note, with men, they tend to use one side of the brain at a time, whereas with women, theirs are a little bit more interconnected. Hi. That's my husband that just sat beside Mr. Simakula. Haven't seen him in a week. So nonetheless, let's get back to the presentation. Good to see you, honey. All right. So the brain is made up of many parts. And as I said, it's a complex thing, and it does many functions at a time. And it's very interconnected. Each side is able to talk to the other side, making sure that your whole brain knows what's going on at all times. To send a message, a neuron, I'm gonna actually go back one slide. So to send a message, a neuron releases a neurotransmitter into this gap area that we see here, or the synapse between it and the next cell. The neurotransmitter crosses the synapse and attaches to receptors on the receiving neuron, like a key into a lock. So there are certain receptors that are released from one side that goes to the other. And if it's not the correct receptor, then it won't bind and the neuron or the cell won't do anything. So the neurotransmitter, which releases the information, other molecules called transporters of, oh, sorry, I mixed up my slide, my apologies. Okay, so your neurotransmitter releases the information into the synapse or into this area, and it crosses, tells the other cell what to do. The cells continue that information on from one cell to the other until the brain gets that thing done. So for instance, if you are getting ready to drink a glass of water, your brain literally releases some information. It crosses these synapses. The brain tells your muscles to contract. You hold on to your glass, pick it up, and you drink. And that's how the brain sends the information to and from different cells in order to make sure that your body does what it's supposed to do. So how does the brain work? So how do drugs work in the brain? So drugs interfere with the way that neurons send and receive and process these signals from the neurotransmitters. Some drugs, such as marijuana and heroin, can activate neurons because their chemical structure mimic that of the neuronal transmitter in the body. So what that means is that, just like we talked about, the signals coming across this gap area, when a drug is used, it's sometimes able to look just like that chemical that comes across here and binds to the receptor on the other side. So whatever that chemical that is released was able to tell the next neuron to do, the drug can sometimes cause that neuron to do the exact same thing. So although these drugs mimic the brain's own chemicals, they don't activate neurons in the same way as a natural neurotransmitter. And they lead to sometimes abnormal messages being sent through the network. Other drugs such as methamphetamine and cocaine can use these neurons to release abnormally large amounts of the neurotransmitters, which is where we end up getting the problem of addiction, which we'll talk about a little bit more further on. So what parts of the brain are affected by drug use? Drug use can alter important brain areas that are necessary for life-sustaining functions and can drive that compulsive drug use that marks addiction. So the first brain area that we're going to talk about is the basal ganglia. So the basal ganglia plays an important role in just positive forms of motivation, including pleasurable effects, such as healthy activities like eating, socializing, and sex, and are also involved in the formation of habits and routines. So if you're trying to, start exercising on a regular basis, and you find that exercising is fun, this is the part of the brain that will help you to form that habit of exercising. So these are areas that form a key mode of what is sometimes called the brain's reward center. So when you have a piece of cake or a piece of chocolate or something that's really nice, your brain tells your body that this is something that feels good, this is something that I like, and I want you to remember it. So this is the portion of the brain that causes those feelings to be ingrained and have you want to do those things again and again. The second part of the brain that we're going to talk about is the external amygdala, which is this portion here. This plays a role in stressful feelings like anxiety, irritability, and unease, which characterize withdrawal after the drug high fades. And thus it motivates a person to continue to seek the drug. So when a drug is taken, it causes that pleasure center to pretty much to light up. And it tells your brain, oh, this is good, we want to do it again. But when you go into withdrawal or it starts to come down from it, this portion of the brain, the amygdala, that's the part that starts to activate. And this part doesn't feel good. So what your body does, it tells you, you need to get this drug again. We need to get that feeling again because we don't like what we're feeling from the extended amygdala. And that's why a person will go back to wanting to use drugs again or to get that high again, so they can avoid the feeling that they're getting here from the extended amygdala. And then the next section is the prefrontal cortex. This is the power or the ability to think, to plan, to solve problems, to make decisions, and to exert self-control and impulses. This is also the last part of the brain to mature, making teens the most vulnerable to this, to having issues, especially if they start using drugs early. So if a teenager or if a young person decides to try drugs at the age of 12 or 13 or 14, because this prefrontal cortex is not fully formed, they will run into the trouble of having it not form completely over time, especially if they continue to use drugs for a long time. So they may get to their 20s and 30s, and because their prefrontal cortex is not fully formed, they're not able to control, be able to have as much self-control as they should. So that's why sometimes with drug users, you'll find an older person who's just will all of a sudden get angry, get upset, and just fly off the handle and not be able to rein that in. And it's partly not their fault. It's because, especially if they've been using drugs for a long time, it's just because their brain just cannot manage that behavior as they're supposed to, because it never developed as it should have. So this shifts the balance between the circuit and the circuits of the basal ganglia and the extended amygdala, making a person with a substance use disorder seek the drugs compulsively with reduced impulse control. So again, like I said, once they start, the earlier they start it, the less likely they'll be able to control themselves in being able to stop the habit of seeking the drug. Alrighty, so how So how do drugs produce pleasure? So pleasure or euphoria or the high from drugs is still poorly understood by science, but probably involves surges of chemical signaling compounds, including the body's natural opioid, which are endorphins, and other neurotransmitters in parts of the basal ganglia, which we mentioned was the reward circuit. So when some drugs are taken, they can cause surges of these neurotransmitters much greater than the small bursts that are naturally produced in association with healthy rewards like eating or hearing or playing music or just some creative pursuits or social interactions. The drugs that are, or one of the chemical that is released, or the main chemical that is released is dopamine. And it's believed that dopamine deepens that connection and reinforces the need or the want for drugs. So whenever there is something that is pleasurable happening inside of our brains or inside of our body, like I gave the example of eating a piece of cake or eating something that we like, dopamine is that chemical that is released. And once those receptors pick up the dopamine, the brain kind of remembers that it likes this thing and it wants to continue to have this thing again. So when drugs are taken, it actually causes an extended release of dopamine. So it releases a much higher amount of dopamine. And then the body is more used to having that high release of dopamine. So when you go back to maybe eating the piece of cake, you don't get that same high or that same pleasure effect as you did as when you use the drugs. But the drawback is when the drug is used and the dopamine amount that is released, the body needs to do more to get you back to that high again. So that is one of the reasons why people, once they start using drugs, they continue to go back to it, one, because dopamine says, we like this is a pleasurable feeling, we need to do it again. And it deepens that connection or that reminder that it's something that's liked. And they get that overwhelming feeling that they cannot get with the same amount of drugs the second time. So they, in essence, have to go and get more drugs and a higher high in order to get to reach that same place that they were the first time that they took it. So the feeling of pleasure is generally how a healthy brain identifies and reinforces beneficial behaviors. The neurotransmitter dopamine, like I mentioned, is the center of this. So whenever that reward center is activated by a healthy or pleasurable experience, a burst of dopamine signals that something important is happening and that needs to be remembered. So this dopamine signal causes changes in your own neuronal connectivity. That makes it easier to repeat the activity again and again without thinking about it, leading to the formation of habits. So just as a drug produces intense euphoria, they also produce much longer surges of dopamine, powerfully reinforcing the connection between consumption of the drug, the resulting pleasure, and all the external cues and lights linked to that experience. So large surges of dopamine teach the brain to seek drugs at the expense of other healthier goals and activities. So when a person that is addicted to drugs gets to the point that they are maybe stealing or lying or doing things that seem abnormal or different from what they used to do or how they used to be prior to taking the drugs, one of the main reasons is their centers or their brain has been taught that this thing that they're doing, this high that they're getting, is so good and it feels so good that they want to do anything in order to get it again. And if you run out of money, then you're going to find a way to get the money to purchase the drugs, or you're going to find a way to steal it to purchase the drugs, just to get back to that high of where you were before. And the cues in a person's daily routine or environment that have become linked with the drug or with the drug use because of changes to the reward circuit can trigger uncomfortable cravings. So whenever the person is exposed to these cues, even if the drug itself is not available, they will do what they can to get it. So this learned reflex can last a very long time. So even people who have been clean or have not used drugs for 10 years, they may return to a house that they may have used drugs in, or a city that they used to use drugs in, and it will trigger a craving for the drug because of how deep that connection was before. So once drugs are started, it definitely takes a long time, or it can be a hard thing to quit. I shouldn't give time because, depending on when the person seeks help or, what they're doing and willpower, that can also help to make the time frame that it takes for them to get back off the drug shorter. So why are drugs more addictive than our natural rewards? So for the brain, the difference between the normal rewards and drug rewards can be linked to the difference between someone whispering in your ear and someone shouting into a microphone. So just as we turn down the volume on the radio that is too loud, the brain of someone who uses drugs adjusts by producing fewer neurotransmitters in the reward circuit, or by reducing the number of receptors that can receive the signal. So the more or the bigger the flood of those chemicals that hit the receptors, the brain says, well, there's so much of it, I don't need as much receptors. So it diminishes the amount of receptors. So in order for the person now to get that same high, they need to have more and more of the drugs in order to have as many of those receptors hit and light up as possible for them to reach that same high. So this makes it the person's ability to experience the pleasure from naturally rewarding activities is also reduced. So the cake is not going to do it anymore. You're going to need a bigger thing to get you to that pleasure that you had once you start using the drugs. So a person that misuses drugs eventually feels flat. They feel like they have no motivation, they're lifeless or depressed, and they're unable to enjoy things that were previously pleasurable. So now the person needs to keep taking the drug to experience even a normal level of reward, which only makes the problem worse, and it becomes like a vicious cycle. So the person will often need to take larger amounts, like I said, in order to get that initial high. And that is known as tolerance. So the more they use it, the more their body is able to tolerate it, and the more they need in order to feel the same way that they did as they initially felt when they started using it. So there are some other consequences of drug use. It's not that just, brain cells that are killed. You can have lung diseases, heart diseases, stroke, cancer, mental health conditions. The issues that come up when a person starts to use drug, it varies from the top of the head to the sole of the feet, just because everything is connected. And then once the brain is diseased, the body follows, and all the things that you can think of can end up happening because they started using drugs. And tobacco is another drug, but tobacco smoke can also cause cancer. Methamphetamine can cause severe dental problems, and one of the things are known as meth mouth. And opioids can lead to overdose and death. In addition, some drugs such as inhalants may damage or destroy nerve cells, either in the brain or the peripheral nervous system. So what ends up happening is a person who's taking drugs, sometimes they're on their peripheries, like their fingers and their toes, they don't feel things as well. And because of that, they can get, cuts or injuries and not even realize it, and end up having severe issues with those peripheries because the nerves in essence are dead or dying in those areas and end up causing them either to lose limbs or just not have feeling in those areas anymore. And again, drugs can also increase the risk of contracting HIV, Hep C, endocarditis, which is an infection of the heart valve, and cellulitis, which is a skin infection. And depending on the route of drug use, so if a person is someone who uses drugs that they're shooting up, then you can end up with the HIV and the Hep C, especially if they're sharing needles. If a person is someone that is smoking or inhaling the drug, again, you can have those cell damages, or you can have issues with the teeth, which we'll talk about one of the drugs that cause major issues with the teeth in a few slides from now. So for drug users, the issue is not only with the user themselves, but it's also with those around them. Secondhand smoke exposes the bystander to at least 250 chemicals that are known to be harmful, particular to children. I thought this was interesting when I was reading it, because I was wondering, why is it that there needs to be this many chemicals in one product in order to make it, I guess, taste good to the person who is using it. But nonetheless, when a person smokes, if they smoke around others, then those persons also will feel the effects of it. And especially children, just like we said with the drug previously, the earlier someone is exposed to it, the more damage it can cause to them. And with marijuana, there's a small study that has shown that effects on bystanders. They haven't studied this much, but with persons who have hung around people smoking marijuana, although they have not smoked it, they've found that a few hours after, they found had positive urine tests from having been around someone who was smoking marijuana. So you may not have smoked marijuana, but if for whatever reason you need to have a drug test, it may show up as positive simply because you were hanging around people who were smoking it around you. So the drug that we're going to talk about is methamphetamine. And methamphetamine is pretty widely used, and not just, when I started looking at this initially, one of the things that I was hearing was that it's not necessarily a drug that's used as much in the African American community. But in going back and doing some of the research, it's kind of everywhere. So I figured this one I'll talk to a little bit more. As we go on, I'll give you some more information as to why I picked this one. But so methamphetamine is a combination of amphetamines, and amphetamines are regular drugs that are used to maintain blood pressure and to treat narcolepsy. So it's drugs that are used in practice by physicians in order to take care of those disorders. So what ends up happening is whoever's making it, they take the amphetamines and then they add over-the-counter medications such as cold medicines, and then they add other ingredients. And you see some of the ingredients here. It is battery acid, antifreeze, drain cleaner, lantern fluid. So pretty much all the things that are kind of out under your sink is what they put into the amphetamines in order to make this drug, the methamphetamine. So it is powerful and highly addictive stimulant that affects the central nervous system. And it takes the form of a white, odorless, bitter tasting crystal powder that is easily dissolved in water. Some of the street names are Ice, Crystal, Tweet, Tina, Chrissy, and Speed. And methamphetamine is so addictive because the main chemical that is released when meth is used is dopamine, which we mentioned before, that dopamine is that chemical that is released when the body wants to remember that something is pleasurable and that it's something that it wants to do again. This is associated with motor function, motivation, reward, and the brain's pleasure center, as we said before. So experiencing these unnatural levels of dopamine causes a strong desire to continue to use the drug. And it becomes addictive because your body experiences intense cravings to maintain the extremely euphoric state, which often results in constant redosing and binge-like behavior to achieve that goal. So the pleasure that's caused by methamphetamine, or the excessive release of the dopamine, lasts for 9 to 12 hours. So when a person takes this drug initially, it's about 9 to 12 hours before they are starting to come down from this high. So having that sustained release of dopamine makes it more likely that the person will want to go back to it. And I didn't give you a definition of addiction, but just in case anyone was wondering, it's a chronic, progressive, relapsing brain disorder characterized by compulsive drug seeking and use despite adverse consequences, which we talked about earlier. A person who is on the drug and wants it, their body wants it so much that they will, in essence, do anything they can to get it. So there are also functional changes in parts of the brain involving self-control and reward and stress, like we mentioned. And untreated addiction results in disability, impairment, and sometimes even death. So I just want to give you some quick statistics around the use of amphetamines or methamphetamines. In 2019, over 70,000 persons lost their lives to unintentional drug overdose. This was a pre-pandemic number. By the end of 2020, that had gone up by 29%. And then in 2021, there was another spike of 15%. And what the pandemic did was kind of mushroomed or blew that up, simply because people were now inside and just had more opportunity to continue to use the drug, and sometimes no outlet to go out and do something that would kind of take them away from getting to the drug each time. So majority of the deaths that were seen were 71,000 in 2021, 71,000 from opioids, meth was 32, cocaine 24, and then prescription drugs over 13,000. So prescription drug deaths are deadly simply because it's not an illegal thing. So when you go to your doctor and you have pain and you get the drugs, you bring them home, you put them in the medicine cabinet. Sometimes your young people can end up going in and getting those and using them. Sometimes it's by accident, sometimes it's intentional. But it definitely makes sense to make sure that you're putting those drugs in a place or putting them away safely so that they're not accessible by young people. And then one thing that I've learned that one of the most common ways for young people to get addicted or get started on drugs or on prescription drugs is when they go to get their wisdom teeth or their third molars taken out. There was a practice previously, it's not done as much anymore, but it used to be that when you go to get your third molars taken out, they would write an opioid, the dentist or the oral surgeon would write an opioid for you, regardless of your age, just to make sure that the patient is comfortable and make sure that they can manage the pain. But that's usually that first taste of the prescription drugs that the young person receives. And then the studies have shown that once they've had it one time, the likelihood that within that first year after they've had it one time, for them to have it a second time increases. So the next time they go to the doctor for whatever reason, they may say, hey, Tylenol doesn't work as well for me, but when I went to the dentist, I got what do we give them? They got an opioid and that worked well, so they may end up getting it again. And that's sometimes where that initial introduction to the prescription drugs start. And usually what we recommend, and I say we recommend because I am a dentist, usually what we recommend is just over-the-counter drugs, and just sometimes even combining ibuprofen and Tylenol in order to take care of the pain, as opposed to using an opioid in order to take care of the pain. Most extractions, wisdom teeth or otherwise, can be taken care of by over-the-counter pain meds. So if you don't have to have the opioids, I would suggest that you don't take them. So meth has now surpassed opioids as the leading cause of deaths in the US, and that's now in the 2022 era. So deaths due to meth have doubled between 2019 and 2021. And I think I mentioned that's with the pandemic numbers going up as well. And one of the reasons for this also is because meth is also not very expensive to attain. So why do people use meth and other drugs? There was a dentist, her name is Dr. Ronnie Brown. She is a leading meth specialist. She did a study of the patients that were coming through her office, and she just decided to start asking them what were the reasons that they decided to start using drugs or start using meth. And they said that they believed it could fix any problem that they had. And they also believed that if they were feeling down, those drugs would help them to feel up and to feel more confident. If they felt lonely, the drugs would help them to feel like they were the life of the party. If they felt unattractive, they would feel more attractive and feel wanted when they were using these drugs. And if they felt sad, they felt more happy. And her conclusion from speaking to them, not only about asking the questions as well as working with them beyond that, is that this was absolutely an illusion. It does not do these things for you or for the person that's taking them. It's just that feeling of euphoria. And once the drug is coming out of the system, then that feeling goes away and you need it again in order to get to that place one more time. So globally, about 27 million people use the drug methamphetamine, and 2.5 million in the US alone. And there is now a new type of methamphetamine on the market, which is called P2P, or phenyl 2-propanone, which replaces some of the ingredients that we mentioned that they have in methamphetamine and makes it even more addictive. So as I said, overall, the drug is very inexpensive, and it costs about $15 to $25 per 1/4 of a gram, which is the size of this little Ziploc bag. And most people are able to smoke 2 pipe loads and still have some left over. So if you pay $25 for this little bag, and then you also are able to smoke it for 9, or you smoke it and it lasts 9 hours. So you can easily go a couple of days on this, and then you go right back out and you can do it again, depending on your money flow. So because of the fact that it's so inexpensive in comparison to some of the other drugs, as well as the high lasts such a long time, people get into the habit of using it more, and it's increasing more so than some of the other drugs out there. Not that the other drugs aren't being used, and not that they're not dangerous. It's just because of the accessibility of meth, it's increasing more and more. So the way how, to give you just, I guess, more of an idea of how dopamine works and how it communicates and why it's such a I guess, huge deal. When somebody does something that's a normal pleasure, like we said, listening to music or eating a food that you love, or doing a creative activity, the base level of dopamine release is 100 units. When someone drinks alcohol, that goes up, it's doubled, it's 200 units. When they use cocaine, that increases 300. But when they use meth, the increase is 1,250 units. So from the base level of 100, and then a person takes meth and they get that 1,250 units of dopamine release, it's a huge jump from where they were at base level. So meth again triggers more release of dopamine than any other drug, and it also blocks the uptake. So as we talked about in the initial slide, where you have the neurotransmitters that are releasing the dopamine, there's also, on the other side, there's also the opportunity or the ability for the neuron to take up some of the drugs or pull it back in order to get rid of the excess, so that there's not an overstimulation. So meth not only triggers the release, but it also blocks that uptake. And then there's also a chemical that's produced that's called monoaminoxidase, which disintegrates or breaks down dopamine, again, in order to make sure that there's not too much dopamine. So meth does those three things. It triggers more release of dopamine, it blocks the uptake, and it stops or inhibits that monoamine oxidase, which is normally used to degrade dopamine. So therefore, that's just constant dopamine bathing the neurons, and you get, again, that huge and long high from using the meth. And again, we said elevated levels of dopamine has some positive effects, prolonged and profound euphoria. But the bigger the level, the longer that prolonged euphoria, the more likely it is that someone will be addicted to it and will continue to want it again. So again, it makes them feel like there's increased confidence, and they become very courageous. So people on meth will do things that they would normally not do if they weren't taking the drug. Some of the negative effects show up in the oral cavity, or many of them show up in the oral cavity. There's hyposalivation, which just means not enough saliva. The saliva's job is to help to buffer the pH that is in the mouth, and to kind of keep bathing the teeth and rinsing away the acids that are produced from the bacteria that's in the mouth. But methamphetamine causes there not to be enough saliva. And it also activates your TMJ muscles, which are the muscles on your temples that connect to your jaw. It activates those and causes patients or people to grind their teeth more, and it increases the cravings for sugar. We're gonna skip, we're gonna skip this one. So norepinephrine is your body's normal caffeine. So on academic campuses, it is thought, or studies have found, that 1/3 of 1 out of 3 university students are abusing some sort of stimulants. So usually, as you may know, people who are studying want more time. You have a test coming up, you need to make sure you get the best grade you can, or you feel like you haven't studied enough, so you want to stay up longer. They will use stimulants in order to help them to stay awake, in order to help them feel more alert, in order to help them feel more focused and aroused. And then one of the other things that I didn't mention about meth, it is that sometimes when people use it, they literally can be awake for 2 to 3 days at a time. And they are laser focused when they're on it. So they are able to study, and they are able to to spend the time doing the work. But the drawback is the longer you use it, the more this benefit, quote unquote, that they think they're getting doesn't work. So they end up having to use more of the drug to feel as if they are more alert and more focused and more awake to do more studying. And also 7.5% of high school students abuse stimulants as well. And I'm gonna skip this one. So long-term meth users tend to have some physical transformation, and I'll show you as well a little bit more on the teeth, because that's one of the places that you do see where the effects of meth are evident. They do have behavioral transformation. So as we said, that it affects those centers of where people are feeling anxious, they're feeling unstable, they're feeling like things just aren't going the way they are, and their mood swings and changes a lot more frequently than a person who is not using meth. With the mouth portion of a meth user, you get rapid tooth decay, the blackened, rotten, crumbling teeth, and also smooth surface cavities, which smooth surface just means like your front teeth, the portion of your teeth that you can see, that's where they're getting the cavities. And we talked about this previously as well. Meth decreases the saliva in the mouth. It also stimulates the alpha-2 receptors in the brain, causing the vasoconstriction of the salivary glands, which just, again, decreases the saliva flow. So while you're decreasing the saliva flow, which helps to protect the teeth from acid, then you also get battery acid that we said was one of the ingredients in the meth component. You get that that is affecting the teeth. You also get that lantern fluid, which also drops the pH, and the patient's body or the patient's oral cavity can't compensate for all those different drops in the pH, and then you end up getting cavities on the teeth. So when a patient comes in, or a person that's using meth, the thing that determines the extent of the damage that we'll see will be the duration. So how long have they been using it? The longer they've been using it, the more likely it is that they'll show up with meth mouth, which is, like I said, those broken, blackened teeth. And for other drugs as well, the longer anyone has been using a drug, the more likely it is that you'll see different issues start to show up. With meth, if they're smoking it, then you'll have issues, more issues in the mouth, because again, you get that lowered pH and you get those increased cavities that are going to be noted. And when the smoke contacts those front teeth, it helps to break the teeth down. The behavior of a meth user is more likely that they'll end up missing brushing and leave plaque on the teeth that will cause the teeth to break down. And again, with the bruxism, so once they have those cavities on the teeth and they're grinding their teeth, that's part of what leads to the fact that the teeth will end up breaking over time. So after 9 to 12 hours, the dopamine levels begin to plunge, which cause a craving for sugar and stimulates that section of the brain that cause the anxiety and cause them to feel irritated. So now they need another high. And if for whatever reason they don't have any more meth, they tend to turn to sugar, because sugar also mimics the same actions as amphetamine, and it triggers the release of dopamine. So that is why when you eat candy or you eat chocolate or anything sweet, it makes you feel good because sugar does the same or stimulates the same receptors as drugs do. So in essence, sugar can be just as bad for you as drugs are. So you got to be careful of your sugar intake as well. So by consuming the sugar, the individual is able to maintain the high. And this though serves as an additional source of acidity for the teeth. So the teeth of people that are addicted to methamphetamine are characterized again by the blackened, stained, rotting, crumbling, falling apart. And often the teeth can't be salvaged and must be removed. So the extensive tooth decay is likely caused by the combination of the drug-induced psychological and physiological changes, resulting in dry mouth and long periods of poor hygiene. Methamphetamine itself is also addictive. So drug use, and especially that of methamphetamine use, can lead to losing your teeth. So it's just not a good combination to be using drugs and trying to have nice teeth as well. This is a patient or a person, not my patient, that was a drug user. This was her at her initial, I think, intake when she was arrested, I think the first time. And then the second picture is 2.5 years later, and she was a meth user. And then the third picture, I think, is another 2 or 3 years later. So it doesn't take a lot of time for a person's body to begin to break down if they're using drugs constantly. And again, this picture on the left side is that meth mouth that I was talking about, where the teeth are broken and you get the blackened areas and the decay. And then the one on the right, and I apologize for anyone that's grossed out, but these are some of the things that you see when patients are using the drugs, and partly because they don't necessarily care so much about what's going on with their teeth, at least not when they're on the drugs. When they're off or when they're not high on it and they come in, then the teeth become important. But once they're using, it's tough for them to be focused on taking care of their teeth or taking care of their body, as well as getting the high that they are seeking. And I think that was my last slide. So if there are any questions, I will take them now. Stop sharing my slide. Okay.
Yes, thank you very much, Doctor, for the wonderful presentation. Like you said, you want some questions. Please, if there's anyone that has any question, you can raise your hand, or any comment, you can raise your hand, or you can just say in the comment section, and then I'll read it. Yes, Sister Lucky.
Thank you very much, Doctor, for enlightening us on the drug use. We have heard about how it affects their lives. Personally, I have a son. He's already a drug addict, and he's not here in the US. He's back home in Africa. I've tried to talk to him. I've prayed with him. I've taken to rehab centers. But when he's in rehab, he reforms. But when he goes back, he does it again. How can I help him? He's already a drug addict. I have talked to him. I've prayed with him, but he doesn't change. And I'm not in Africa to be with him.
Right. It's definitely tough because remember that initial or earlier in the slides that I mentioned that when you go back into the same situation, the cravings come back. So when he's in the center, he's able to kick the habit, so to speak, and he's able to do that because he has help. He has someone that's kind of working with him and walking him through the things that he he needs to do in order to come off of the drugs. But if he comes out of the rehab center and he goes back to the same place that he was before, it's going to be really hard for him to avoid taking up those same habits again, because in essence, his body is calling for it, because that's what he's used to. So one thing that may help, I'm not sure if this is a possibility, is a change of environment. If he can change from once he comes out of the rehab center to not go back into the same environment, that would be helpful. As well as, does he want to stay clean or no?
He lives in denial.
Mm.
He's always denying. Whenever I talk to him, he denies. And when I'm talking to him, he feels as if he has understood what you have talked to him, but he's always in denial. That's the problem. And another question, do you have any book or any audio you can help us with?
I can send a list to Mr. Simakula, and then just a list from what I have and what I've heard about as far as things that you can use. But I would also say for your son, definitely keep praying for him. That's one way. Because if you can get him to the point of understanding that he does have an issue, which is not going to be easy to do, because remember I said that there are actual changes in the brain, and you don't feel like, not everyone always wants to get help or feel like they need to get help. So it's kind of a matter of staying on your knees for him, as well as whenever, if ever possible, trying to change that environment to see if that would be helpful to get him to not go back into it. But it's not an easy task.
Thank you, doctor. Thank you.
You're welcome.
Hello, doctor. Thank you so much for that presentation. Could you please tell us the effect of drugs on reproductive health, if there is any?
Go ahead.
Oh, sorry, doctor. And after that, Maria will be next.
As with anything, because the earlier you start to use it, the more effects it can have on your reproductive health, on any portion of your health. So if you are a young woman or a young man, actually, there are instances where, the sperm count can go down, or just the fertility can be affected over time. So the longer you use it, the longer you are affecting your body with it, the more likely it is that you can have issues with being able to reproduce when you're ready to reproduce, especially if you start using at a younger age. So just like how when I mentioned like a teenager or someone who starts using it early, their brain doesn't develop as it should, you have similar effects where when they're using it younger, the reproductive system can be affected as well. I don't have percentages or numbers to give you off the top of my head, but there's definitely an effect if you start using sooner than later. Not that later is okay either. Okay, I see your question, Betty, but I heard Mary was next, so I'll answer that one after.
Thank you very much, Doctor, for the wonderful presentation, and thank you, Mr. Kaiwa, for organizing this. My question is about sugars. You mentioned something about craving for sugars. And I know you talked about the environment. I know we live in the US, where the environment everywhere is encouraging children to have sweets, if they have a craving for sweet things, it's not going to help. What advice would you give us to prevent, or preventative method you would advise us or give us to prevent them from getting to that addiction? Because I have a young one, very young, 7, but I see how much addicted she is on sugars. Even if I don't buy it at home, I don't buy sugars. When we go parties, the only thing she reaches out is sugars. I see how much, and being around people who know, they'll just say, oh, she has a sweet tooth, but how
Yeah.
would you help us?
It is a very annoying thing. As Papa Simakula said, I have 4 children, and mine range from 11 to 5. And we have the same issue. Like, we'll go out at home, we'll try to keep them away from it. When we go out, other people will give it to them, and they, of course, are quite content with it because it's not their kids. But one of the things that my husband and I have tried to do is, and I know I'm not sure if it's your daughter. I see a little girl on your picture, but we tried to kind of talk to the children about the issues with having too much sweets. And we try to also keep it out of their diet. So they're not as, there's definitely not as much of it at home, but help them to understand why there's an issue with taking the candy when it's offered to them, why it is that having so much sugar is not good for them. Show them pictures of what happens to teeth. Don't traumatize them, but be real and straightforward with them. And I'm sure at 7, she's able to reason, because I find that, sometimes they're 7 going on 70. But tell them what the effects will be if they continue to do that, not being judgmental or not being punitive, but just have an open conversation and let them know, hey, I understand that you like this, but this is what can happen if you continue to eat so many sweets or such and such. And then make sure that you help them to make up the rules around what should happen. So if you only want them, it's probably not going to be the easiest thing to make them quit cold turkey. But if you only want her to have 2 pieces of sweets for the day or for the week, whatever you determine, allow her to help make up those rules and help her to stick to it. And you could even give her a reward. So if she makes it through a week and she only has those 2 pieces of candy, then the reward is, 30 minutes of playtime, whatever you all decide. So try to redirect her from seeing sugar as a treat, so to speak, and seeing it more like, a once in a while thing, and you don't absolutely have to have it. And at home, you try to adjust her taste buds, so to speak. Do what you can to leave as much of the sugar out of the diet as possible, and then speak to her cognitively, let her know, hey, this is why mommy said no to X, Y, and Z. Because you'd be surprised how well the kids are willing to reason, especially when you give them the opportunity to be involved in how not their punishment, but how things are developed around them. They're definitely willing to be able to step in and give suggestions and so forth, and be willing to talk to whoever it is where you go, and just be like, hey, this is what I'm trying to do at home. I'd appreciate it if you back off of giving the candy. Because I've had to tell folks, especially at church, that I'm just like, no, they don't need it. And of course they're telling you, oh, they're kids, they should have candy, and it's just like, well, I hear you, but no, you just have to be firm and let them know this is not what is acceptable. It doesn't matter if they don't like you. It's about your child. So you got to make sure that firm as you can, but change their habits as much as you can while having that conversation with them. So you can hopefully get them to a place where it's more comfortable and they're eating less and less of it. And I think.
Thank you very much.
You're welcome. Betty asked, what symptoms should you look for to spot and nip drug habits in the bud.
Hello, dear.
I'm sorry.
I'm sorry I'm sorry to interrupt. I just wanted to add on to your response there. From a nutritional standpoint, also provide them with alternatives, with sweet alternatives, so to speak. When you make certain foods fun and interesting. So we know that the alternatives to the candy, the natural sweets, are the fruits and things like that. So a lot of times you can make various types of fruits interesting and fun when they eat them. I know for our kids, sometimes we use we sort of make icy pops out of them and things like that. If you freeze them, and they're enjoyable that way. So a lot of times you can give them healthy alternatives that are also sweet, as Dr. Webley mentioned, adjusting their taste buds to the things that are more healthy. Thank you.
True. As parents, one of the major things to look for is changes in just the way how your child is presenting. So first of all, I would say make sure that you're having open and honest conversations with your children around drugs. We don't want to wait until they've tried it in order to say, hey, something is different and we want to step in. So the sooner you can talk to them about it, the sooner you can hear what they're saying. Leave space for them to be able to come and talk to you about anything. And some of the things that you may hear may just be like, not the most fun thing for you to hear. But if you leave the space for them to be able to talk to you when things come up, when those peer pressures start to happen, it'll be more likely that they're going to be willing to come and discuss those things with you as well. But definitely, if it is that they've tried it, you'll likely start to see changes. Like they'll start doing things that they don't normally do. Sometimes they get angry easier, or they want to shut you out of everything, which I know teenagers do that regardless. But ask questions. Don't be afraid to, hey, knock on the door. Can we talk? I noticed this is going on. I noticed that you've been yelling at your sibling every other day. What's the deal? Is there something that we need to talk about? And if they don't feel like, and you can offer options like, hey, if you don't feel like you can talk to me about it and you wanna write it down and leave me a note or something, but be open and try not to, if they tell you something that you aren't happy with hearing, do your best not to yell and scream and carry on at them. Because if you show them that it's not safe to talk to you, the next time they won't talk to you. So you have to, in essence, be a safe space for your children to be able to come to you and tell you anything. Because if you're not a safe space, their friends are going to be. And those people, out there that are trying to influence them to do everything under the sun, they're going to be that safe space for them. Hope that answers the question, Betty. And then I see.
Thank you. Thank you very much. Did you also answer for JN? Okay, that's not a question. So we may have one or two questions, and then
I can speak a little bit to JN. Pray for how you respond to them, and ask the Lord to change your approach to them. It's always easier to look at somebody else and say they have an issue, they won't do this, they won't do that. But sometimes if we focus on us first, if we say, you know, because they're still your sons, you love them and they love you. Your goal is to raise them to be those, you know, soldiers in the army of God, to be stalwarts for Christ, to be servants of the Lord. So for whatever reason, there sounds like there's some sort of a rift between you and them. So I would start with spending time in prayer concerning you and how you approach them, just to make sure that you're where you need to be. Because if you're looking at them, attempting to change them, and whatever they're seeing in you feels or seems hypocritical, then they're going to continue to push back. They're not going to come and say, you know, yes, I want to talk to you. I want to have a conversation with you. So I would say work on you first, and then allow the Lord to move you pertaining to how to approach them. I hope that helps. That's how I would approach it if it were my house.
Well, thank you very much. Also, Doctor, you talked about the over-the-counter medication. I just wanted to share a small experience. At my place of work, they brought a minor who was, I believe, 14, and she had took a lot of pills over the counter, but came to find out that she's in a shared parenting, where when she goes to the mother allows her to take whatever she wants to take. So this message is just going to the parents who are sharing, like co-parenting with maybe they're going through co-parenting, that just make sure that at least you take precautions and you make sure when it comes to hiding the drugs, because you may do your part hiding your drug, the medication, but when the kid goes to, or maybe to the father allows the kid to take medication. I've had actually 2 instances at my place of work where the parent is trying to buy love from the child and just allow the child to take whatever the child wants to take. And yeah, thank you.
Yeah, that can be tough. And I think Jaja had her hand up for a while.
Yes, thank you so much, Doctor, for your presentation. It has been very, very good. Well, I have a couple of questions, but the first one actually, you mentioned, the prescription drugs.
Mm-hmm.
Now, like for my case, I had the first spinal fusion, 2001, 3 levels. Then, of course, as you know, when you come back from there, they give you all this strong medication because the pain is out of this world.
Mm-hmm.
But because I'm a nurse, I knew that, there's trouble, you can get addicted. So I very quickly, as soon as I could, got off, and I started saying, no, let me take at least something anti-inflammatory like Motrin, ibuprofen. So they gave me the highest dose, 800 milligrams, 3 times a day. And I took that, even though it wasn't very effective, but then I would use the TENS unit. I have the one I put in the electricity.
Mm-hmm.
It's really, really big. And I used to go for spinal nerve lesioning, like they put a needle in the nerve, like every 6 months, and they kill the nerves. But the time came that due to scar tissues, they were so hard that when they put the needle would bend. It could barely go in, they jam it in there. And so one time the blood pressure went so high that they thought I was having a stroke. So they stopped those.
Okay.
And to make the matters worse, 2016, I had another spinal fusion. They removed all the other hardware, and then they went up 4 more. So I had 7 discs, you know. I have 7 levels, so I have a lot of hardware in my back. And the pain is, I was almost getting somehow better, and then a car hit me in the back. I was on a stop sign. So to cut the long story short, the pain is a lot. And, you know, I didn't want to take all those narcotics, this and that. So, and then Motrin, I took it for so long, like maybe 10 years, and then it started making my skin getting black spots like a leopard. So then I got off that. Now what do I do? What do I do? I don't want narcotics. So then they gave me Tylenol number 3 with codeine. Now codeine is an opioid. So I said, okay, I'm gonna take the smallest, you know, like 1 a day, you know. And now I break it, I take a half, you know, plus the heating pad, this and that. So what do we do? I mean, like, if you, it's like, I'm not abusing, but I need it for pain. What do I do? Even now, as I speak, I have my belt on, and you know, I took a half to be able even to stand. Others to sit. Others, I'm gonna be laying down. I don't go to church, you know, because it's hard to sit too long. So what do we do, really?
Yes, that is tough. It's tough if it's something that if you need it, you need it. That is definitely, you know, different than the person who's abusing like a Percocet or something that's heavier. I like your approach that you're trying to keep it as minimal as possible. The only other thing that, not only other thing, but one other thing that I know, and I know you use the heating pads, but you doing contrast showers can help. And contrast showers are hot and cold showers. So, and how that works is you can do 3 minutes of hot, and you take a shower as hot as you can take it. And then you do 30 seconds of cold as you can take it. And then you do 3 minutes, and then 45 seconds, and then 3 minutes of hot, and then a minute of cold. And what that does, it helps to break up the inflammation in the area. Because a lot of the times you end up feeling pain from inflammation and just the constant pressure that's in the area. So that's one way. So the heating pad helps. If you don't want to take a full shower, just alternate your hot and cold heating pad. And that can help to kind of break that up and help with it. And of course, you know, trying to, as much as you can, you know, exercise. If you can't walk, walking is one of the best exercises that you can do. But if that's not an option for you, if you can get to a pool, that would be great as well. So if you go in the pool, you can do exercises that will help to loosen up those areas and again, break up the inflammation, but it's not as hard on your body as if you're walking outside on your own. So those are 2 things that I've tried for myself that has worked to help with minimizing the pain. And you may still have to take your Tylenol. And if you have to, you're in pain, do what you need to do. But I would also work with your physician. I know you said they were doing the physical therapy. Just ask, just be like, hey, you know, is there anything that we can do to help with this pain outside of taking the pain medication? I'll keep taking it as I need it, but what else can you suggest? And then there are sometimes there are holistic doctors out there that try to work with getting to the cause or the root issue of whatever problem you have in order to get rid of it, as opposed to continuing you on medication. I don't know what area you were in, and I only know of one actually that off the top of my head. Her name is Kenesha Reynolds, but she's all the way in California. But a holistic doctor sometimes will be able to help you walk through those steps. Because I think there's even, you know, certain things that you can eat and drink that's anti-inflammatory that will overall help the body to to heal and process a little bit better, to get rid of the inflammation, to get rid of the pain, as opposed to doing the medication.
Thank you so much. Now, I'm not even done yet. Now, what if you have older kids and you see them sneaking, sometimes they sneak some like wine, but they lie to you, but they sneak, but of course they are old, like you can't deal with them like little kids. Or sometimes you may smell something that smells funny and say, what that smell? Is that marijuana? What do you do with those kids? Like they are grown up, you can't like, tell them, oh, I'm taking you to counseling, they can say yes or no. So what do you do with those?
I think the same thing, in the sense that you're honest with them. And if you smell marijuana, you ask questions like, hey, I know you came over on yesterday and I smelled X, Y, and Z on your clothes. What's going on? Be straight, like God is straight up and straightforward with us. Like when we're doing stuff, he comes to us and he's just like when Adam and Eve sinned, he's just like, Adam, where are you? He came and he's just like, he's straight up and he makes sure, he asks us, what are we doing? What are you doing here, Elijah? And Elijah's just like, I'm hiding, but I think the same way we have to deal with our children, especially if they're grown, they're making their own decisions. But don't approach it in a judgmental way. You can't go to them and say, it's a sin to do blah, blah, blah. It's a sin to drink wine. It's a sin to smoke marijuana. Because once you start with that, they think that you're judging them and you're using your religion to beat them up. So just be straightforward, ask the question, see what you hear. And you can give your feelings, like, I hear you. I see that you're trying X, Y, and Z. This is what I understand about marijuana. This is what I understand about, drinking wine. Maybe we can look at it together. Maybe we can see if we can do some research and see and offer that, be willing to step in and say, hey, let's look at this thing together. Let's do some research. Let's see if this, what you're saying, because they're going to tell you, oh, there's no problem. It's not an issue. I'm not going to get addicted to anything. I'm going to be fine. But marijuana sometimes tends to be a gateway drug for some of the other stuff. So they'll start out there and they'll think everything is fine and hunky-dory. But then when they're not feeling as high as they used to, sometimes they may step into the realm of trying other things.
Thank you. Thank you.
You're welcome. And I think, Howard, you had a question, or Mr. Simakula?
Yes, thank you very much for this very well done job. We appreciate. God bless you. You talked about sugar, you talked about caffeine, but you did not say about tea. Is tea equally as deadly a stimulant that will cause alertness, focus, arousal, wakefulness, and productivity? Or is that something that we should avoid, please?
I believe that yes, in the sense that if it's caffeinated tea, because then you still have the same effects that you get from caffeine. So there are options of using herbal teas that don't give you the effects that you have to deal with caffeine. Caffeine tends to, it stimulates you. You feel good after you drink a cup of coffee. You feel like you're awake, you're alert, but it ends up tanking fairly quickly after. And most of the time people end up feeling, worse. So they have to go and get another cup of coffee to feel more awake and alert again. So I think it's the same. If it has caffeine in it, then you run into the same issue that you will, whether it's coffee or if it's black tea or green tea, any of those that have the caffeine in there. And I'm sure someone on here may say that, you know, there are good effects of such and such, but I think you still have to be mindful of the whole makeup of whatever it is that you're eating or drinking. They do use caffeine, I believe, to treat like migraine headaches at times. But again, that's treatment as a medicine as opposed to using it to wake up or using it to feel like you can keep going throughout the day.
Thank you.
You're welcome.
Just wanted to add something quickly to those that are out there who are still sort of asking the question about what do I do when my young person is may be involved with this sort of thing, any sort of drug situation. I just want you to keep in mind that that every form of addiction, always the root of it is always a feeling of emptiness or something that is missing, that needs to be filled, that needs to be replaced. And so people are always looking to fill some form of void that they already have. And so that's why what Dr. Webley is mentioning about having the conversations and discussions and not necessarily in such a formal manner, but making and developing relationship with your children is so important, so that they can feel loved and desired and listened to and heard. You know, so I just want to mention that I guess emotional wellness aspect of it as well, because that ends up being the root of why they are looking for fulfillment from these other things. I just want to put that out there. Keep them in prayer, pray with them, make sure that they're starting to develop an understanding of how to go to God for things that they're struggling with. You know, model that before them. So that when you mentioned Elijah, it's a really good example, because when he was out there, the fact that he was out there was not really the issue. The issue was so much, why are you out there? What are you running from? What are you trying to avoid? And so that was the conversation that he was able to have with Elijah at the time. And so Elijah was going through sort of a depression type of experience. So it's very important to develop the relationship. Thank you.
And also, don't be afraid to seek out help for your children, because again, as Howard mentioned, there are times that they're going through things, and some of it could be absolutely clinical. They might have depression, they might have anxiety, they might have ADHD, they might have undiagnosed things that you're just not aware of. And, you know, sometimes if you're noticing things, if that, you know, that mama vibe or that papa vibe is not settling, just ask some questions, talk to their counselors, talk to their teachers, ask, you know, be present and be available. And I know sometimes it's tough and it's busy. Like I'm from Jamaica, and when my mom came here to the States, there wasn't much time for her to come and check in on us at school and make sure that we were good. So we needed to make sure that we were good. But when if something did come up, she made the time. She made the time to make sure that she was there. She was able to talk to a teacher when things needed to be talked about. And so we have to, as parents, be intentional about making sure that we are checking in on our kids. And sometimes it's just a matter of sending the teacher an email. Hey, you know, James said X, Y, and Z, or I've noticed this and this and this about him. Have you seen any of that in your classroom? Is there anything that's going on that's off kilter or out of order for what you normally see? And depending on the school, of course, the teacher may not be paying such close attention, but you never know. So if you're noticing something, if you're feeling like something is off, be willing to take the step to ask the question. And I know Papa Simakula had mentioned that sometimes, you know, there's a struggle with the language. Ask somebody to write the note for you. So this way you can, you know, send the email, and then when the email comes back, you ask them to translate it if it's tough. Because we don't want to miss out on those windows of getting our children the help that they need because of whatever that barrier or that thing may have been that caused us to not ask the question. So be willing to ask. Martin? Looks, I saw your hand up.
Thank you. Yes, thank you so much. I just wanted to add on to that. I do appreciate all the wonderful knowledge that we're able to get today and having this conversation because it's really good. My name is Ellen. I'm here with Martin. I just want to add on, like, it's definitely important. And I know, oh gosh, I just lost the name, but I know he just mentioned something and I just wanted to add on to it, that even though it might not be something going on, especially with this generation, because I am a millennial, and some people just do stuff because they just want to experiment life, right? Like the company that they keep, and they just want to try stuff and just live life, really. That's what they call it. So, but having those conversations is definitely important, like you said, having that open communication and just having that safe space where the kids can come and be like, okay, I know it's probably not right, but I feel comfortable going to my mom and say, maybe I messed up, or this is what I'm going through, or this is what's happening. Having that safe space to have those conversations is definitely important. And as far as the parents go, having that open mind and not be so defensive or be so much into like the African way, like set up in that African way, like just have that open mindset and be able to hear the kids' point of view or where they're coming from or what they're going through or whatever the case might be, so that you can get to that solution or get them to a new step where they need to go in a new direction. So I appreciate that. I just wanted to say that real quick. Thank you.
Absolutely. Thank you.
Thank you. In the interest of time, I'll just entertain just one more question. We can wrap up, Doctor.
Yeah, thank you so much for the superb presentation. I just have a question about those individuals whose teeth are completely wiped out. Can dental implants be an option for such individuals, or is it the bone structure is so damaged that even the implants wouldn't work?
Implants can be an option. It definitely depends on how soon we're able to get to them. So the longer, of course, they wait, the longer they've been, you know, chewing on or eating with the broken teeth or being without replacements, then the tougher it is. And even then, there still can be options because there's some bone grafting, like if it's on the top, they can do what we call a sinus lift, which just means they add bone into your sinuses in order to give more space for them to be able to put the implant in place. So for the upper, definitely a possibility. And then for the lower, if everywhere else is damaged, if you have enough bone, like where your canines used to be, that's usually the most bone that you have in that area. Sometimes they're able to put implants there, and they're also mini implants. So they make them just really tiny, so they're able to use less bone in order to place them. So yes, implants can be an option, but definitely depends on how much bone we have left. So the sooner they get in, the better. All right, any other questions?
Thank you very much. I don't know if we have any other question, but if you're still available, doctor, we could have one more question. Otherwise, we can have one more song, one closing song, and then we can have a closing prayer. We have somebody in the chat, Bridget. Oh, okay. She's just thanking you.
You are welcome. Thank you.
I just want to share a little bit of an announcement as we get somebody to sing for us. My wife is actually going to sing for us a closing song. As she sings, this announcement will stay on the screen so everybody can see it. He leadeth me always faithful, all words with heavenly comfort flow. Whatever be, wherever I be, still 'tis God's hand that leadeth me. He leadeth me by his own hand, he leadeth me. His faithful follower would be, for by his hand he leadeth me. Sometimes means sins of deepest gloom, sometimes we eat Eden's flowers bloom. By waters still or troubled sea, still 'tis his hand that leadeth me. He leadeth me, by his own hand he leadeth me. His faithful follower would be, for by his hand he leadeth me. Lord, I would clasp thy hand in mine, nor ever murmur nor repine. Content whatever, Lord, I see, since 'tis thy hand that leadeth me. He leadeth me, by his own hand he leadeth me. His faithful follower will be, for by his hand he leadeth me. Thank you very much, Sergeant Kaiwa. Well,
Amina.
I want to take this opportunity to